Good morning, everyone. My name is Ole Ljungqvist, and it is my pleasure, alongside my co-chair, Regina Rolle-Winsberger, to welcome you all to this live event on EU4Nutrition. We're gathered here to support the main effort launched by the EU to fight cancer, the EU4Cancer plan. It is because we need to fight the burden of cancer in Europe. We have 2.7 million new cases in 2020 and 1.3 million deaths. And the central feature of the Beating Cancer Plan, which is an essential part of all of this, is that, and I quote, "Everyone should have the same right to high quality care, diagnosis and treatment, the same access to medicines, and the same hope of survival." And today, we are going to present to you that in order to achieve all of this, there has to be proper and appropriate nutritional care as an essential part of the care that we're delivering. It is also my pleasure to welcome you on behalf of APNEP. It's a very successful Portuguese Society of Enteral and Parenteral Nutrition, and on their leader, Anibal Marinho. And we're running this under the auspices of the Portuguese Presidency of the Council of the European Union and the Portuguese Ministry of Health. We have more than 30 countries listening to us today, with a wide variety of listeners, from patients to healthcare professionals of all kinds, to politicians, to journalists, and also people from the European Commission. We're not only live on the internet like this, but we're also live through Twitter and Facebook, and whichever way you're listening, are heartily welcome today. We do have a very exciting program for you. We have 8 speakers. We are going to cover the patient's view of things, the science behind the care that is needed. We're going to talk to healthcare professionals and representatives from the European Parliament and from national governments. This is a step in our journey to secure optimal nutritional care for patients and make sure that everybody gets proper nutrition alongside the rest of the care. We're going to hear about the science, the policies, and the practices. And if you have questions, please send them in via the chat and the Q&A we will have at the end of the session. If you have any technical problems, please use the chat function of the Zoom system. The aim of the meeting is to try to identify recommendations on how we can implement the nutritional cancer care in everywhere where it's actually going to need to be done, that is on the floor. So we'll take the next slide. At the European level, the members of the European Nutrition for Health Alliance are the leading professional societies, and they're all related to nutrition as well as patient organizations. And we also have medical students joining us. And this integrated approach to the care actually ensures that we cover all aspects, from the patient's journey all the way to how we deliver it, how we teach it, and also to the industry. The full nutritional care system. And the next slide. Because healthcare actually happens on the floor, it is imperative that we reach where the care is delivered in implementing our new practices. And this has to be done in every member state, in every care delivery station, whether it's a hospital or a home care or wherever it may be. And therefore, the European Nutrition for Health Alliance has launched its Optimal Nutritional Care for All program, ONCA. It is a multidisciplinary approach where teams are sharing good practices with anybody who is interested across the world and between countries. We have 19 European countries have joined so far. And if you're not a member, please join us. And anybody can look at our website, that is, and you have the website right here. So we'll take the next slide. So just before we start, I'd like just to give you a little more background to pinpoint what we're aiming at today. Europe's Beating Cancer Plan was adopted earlier this year. It's a 4 billion cancer plan, 4 billion euro cancer plan, I should say, and it sets out a new EU approach, not only to cancer prevention, but also to the treatment of care. It is there to tackle the entire pathway from prevention all the way to the quality of care of the patient, regardless of where in the cancer treatment, which stage you're in. And it focuses on actions where the EU can actually add to the most value. The nutrition care plan in cancer is something that we have accomplished to make sure that nutritional support has become a part of the Europe's Beating Cancer Plan. And we have secured the commitment of the Commission's cancer team to include support of cancer patients through screening of malnutrition, medical nutrition being delivered, and the use of proper treatment guidelines. But we do need a little more. We need to have more concrete recommendations on how we are to implement these treatment plans. Because it is like the Commissioner Ursula von der Leyen stated, the challenge of the plan, it lies with its implementation. Before it's reached the patient that is in need of the care, it is really of very little use. Finally, it is a pleasure to announce that the Portuguese presidency is committed to further the implementation of the cancer plan. So with that said, welcome again, and it's my pleasure to introduce our first speaker. Appropriately enough, we start with a patient. Robert Green is a board member and a nutrition lead of the European Cancer Patient Coalition. He's speaking here on the behalf of the patients and also as the president of the Hunger and Thirst Foundation. And the presentation he is giving has the title, Optimal Nutrition is a Patient's Right to High Quality Cancer Care. Please, the floor is yours, Robert.
I want to thank the European Nutrition for Health Alliance through its Portuguese team and the Portuguese Ministry of Health for this opportunity to speak at this digital conference. I want to welcome all the participants to the event. Your presence shows the importance of implementing optimal nutritional cancer care at EU member state level. My name is Robert Green, and I'm a board member of the European Cancer Patient Coalition and founder and president of the Hunger and Thirst Foundation. The European Cancer Patient Coalition is a European cancer patient organization representing those affected by all types of cancers. Hunger and Thirst Foundation focuses on nutritional challenges which may affect quality of life and treatment outcomes of those affected by cancer. Is optimal nutrition essential in cancer care, and can it improve and maintain quality of life? The SDGs website states that the 2030 Agenda for Sustainable Development, adopted by all United Nations member states in 2015, provides a shared blueprint for peace and prosperity for people and the planet, now and into the future. Goal 2.2 targets ending all forms of malnutrition by 2030. The provision of nutritious food is a central objective of EU policy. Article 3.4 of the Beating Cancer Plan, which was presented in February of this year, mentions improving health promotion through access to healthy diets and physical activity. I started my presentation by saying that optimal nutrition is a patient's right to high quality cancer care. Let me correct that by saying that optimal nutrition is the right of every citizen and is a vital part of high quality care. Optimal nutrition should be the ultimate goal within each member state. What is nutrition? Nutrition is the quantity and quality of food that the body receives. Different kinds of disease, weakness, and disabilities are closely related to the intake of insufficient food nutrients. And what is optimal nutrition? Optimal nutrition promotes optimal health. The World Health Organization defines health as complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. How is optimal nutrition associated with high-quality cancer care? A shift in the current patient management would allow more focus on nutritional support, in addition to clinical care. Malnutrition, a common problem in cancer patients, needs special attention from the moment of diagnosis to improve quality of life and treatment outcomes. Why is optimal nutrition a citizen's right, a patient's right to high-quality care? The European Cancer Organization recently introduced the European Code of Cancer Practice. The Code of Cancer Practice is a citizen and patient-centered, accessible, and widely disseminated statement of the core requirements for good clinical cancer practice, with a focus of improving outcomes for all of Europe's cancer patients. It has been co-produced by a team of cancer professionals, cancer patients, and patient advocates. It has its origin in the European Cancer Patient Bill of Rights, which was launched in the European Parliament on World Cancer Day 2014. Code 1 mentions the right to equal access to affordable and optimal cancer care, thus as well as the right to optimal nutrition. When discussing optimal nutrition, it signifies having equal access to optimal nutrition in all EU states. What about a patient's views on nutrition? In 2015, a survey was conducted by the European Cancer Patient Coalition among 907 people with cancer about the importance of nutrition. The preliminary data suggested that discrepancies still existed between patients' expectations and the answers they may get from physicians about the metabolic and nutritional issues in cancer. The survey concluded that most people with cancer reported that they would like to receive more information about improving their nutrition during and after treatment. More than 70% of the participants experienced feeding problems during the disease or therapy. Almost 30% had no information on nutritional support, including artificial nutrition. I argue for focused attention and advice on nutrition before, during, and after treatment. We cannot ignore the health economic benefits of optimal nutritional care. There is a need to empower individual patients and patient organizations by producing more information on patients' nutritional needs. To conclude, optimal nutrition is a right. Rights are considered fundamental to any civilization, for they are regarded as established pillars of society and culture. We must now work together to ensure that policies are established and implemented in EU states so that citizens and cancer patients have access to optimal nutrition. Thank you.
Thank you, Robert, once more. It's now my great pleasure to introduce the next speaker, Professor Alessandro Laviano. Alessandro is an associate professor of internal medicine at the Department of Clinical Medicine, Sapienza University of Rome, Italy. He is also the director of the lifelong learning program of ESPEN, and he is always invited to act as an expert reviewer for framework programs of the European Commission. It's my pleasure to welcome you, Alessandro. Professor Laviano is going to give a talk on protecting nutritional status in cancer is critical to patient outcomes. The floor is yours, Alessandro.
Well, thank you very much, Regina, for the introduction. And I really would like to thank ONCA and the EU presidency, the Portuguese presidency, for organizing this live event, which I think will help to realign which should be the focus of our plan to fight cancer in Europe. So these are my disclosures, and I really would like to start by quoting the Jim Lovell, or maybe it was Jack Swigert on Apollo 13, who were saying we have a problem. I think that Europe has a problem because you understand that Europe represents approximately 10% of the world population, if we consider also Russia in this case, but we account for more than 20% of all the death every year in cancer, and approximately 20% of all the new cancer patients all over the planet. So we have a problem, definitely a problem. And of course, it's a problem in prevention. And sometimes Robert has just mentioned the importance of optimal health also to prevent cancer. But of course, we have a problem in effectively treating these patients. We did a lot to improve the treatment, but maybe we can do a little more, and more importantly, with a cheap approach. So let's review together which should be the optimal approach to a patient with cancer. If a patient is diagnosed with advanced cancer, of course, he has to start two kinds of therapy. the disease-modifying therapy, which targets the cancer cells. So the goal of disease-modifying therapy is actually survival. But the patients have the right also to receive supportive care, also called palliative care. And palliative care addresses the needs of the patients. And it's, of course, nutrition is part of this palliative care, is a great part of this palliative care, because unfortunately, malnutrition is very prevalent in cancer patients and has a negative impact not only of quality of life, but also on the survival of these patients. Just to give you some example, these are data. Again, these are data. These are not opinion. This is not my opinion. This is fact. The malnutrition, and particularly the loss of muscle mass in cancer patients, you can see very nicely is associated with the worst depression for cancer patients. And more importantly, you see in the other table that unfortunately the presence again of muscle loss, which again is a key feature of cancer-associated malnutrition, is associated with the reduction in survival. So what we should do for these patients, of course, we have to treat the cancer cells, we have to target the cancer cells, but can we do something for the patients? Well, we have to remember that the clinical journey of a cancer patient is quite a long one during which there are some catabolic crises, which of course is chemotherapy, is surgery, is adjuvant therapy. And during these catabolic crises, body weight, muscle function is significantly reduced. So the idea is that every single cancer patient should receive a chronic intervention. They should know what they have to eat, what to have to actually prefer or not prefer. And this chronic intervention is really on preserved body weight, body function, autonomy, diet quality, and the both also on physical quality. Definitely, we also need some kind of more specific acute intervention during these catabolic crises. And in these specific crises, we need really to target the body weight, the body composition, and every single intervention should be patient-tailored and based on counseling, or nutritional supplements, and if needed, even on artificial nutrition, enteral and parenteral nutrition. Now, of course, the major question is, but do we have some data showing that this approach is actually effective in improving not only the quality of life, but also stronger outcome measures, like, for example, survival? I'm really like to present with you these very recent Italian data. Paolo Pedrazzoli and his team. Paolo Pedrazzoli is a medical oncologist working in the Lombardy region in Italy, and he was digging in the database of 10 local health authorities in Italy. And he found actually approximately 50,000 cancer patients who receive clinical nutrition support, mainly enteral and parenteral nutrition. He was looking whether this intervention was improving the outcome, the most relevant, one of the most relevant impact an outcome measure, which is survival. And you see very nicely here that the timely intervention with nutritional support is associated with a significant improvement in the survival for patients with GI cancer, with respiratory cancer, with genitourinary cancer. And this has been achieved not because of new drugs, but actually because of the implementation of what is already existing. So basically, tomorrow morning, every single state member can implement the use of nutritional support and having these fantastic results with a minimal investment and financial investment. And more importantly, this intervention will reduce the inequality between European citizens, because this is independent from the national budget of each state member. Now, these data are really important, really impressive. You can improve the quality of life, and you can also improve the quantity of life. So you can help the patients to have better and longer life. And this is with a fraction of the cost of chemo, radio, target therapy, immune therapy, and so on. I'm not saying they're not important, they're very much important, but we can add more to these, to the results obtained with these effects. Now the question is, but how frequent this happens. So are these 50,000 Italian cancer patients representative of all the European cancer patients? Unfortunately, we don't have statistics showing how many cancer patients in Europe do receive early supportive care, early nutritional support. We can base our discussion maybe on these data which comes from the US, showing that unfortunately in the US, approximately 50% of all cancer patients with advanced disease receive early supportive care, which of course translates into 50% of cancer patients do not receive early support, and therefore they are not allowed to get the benefit of early nutritional nutritional support. So I think that really this plan, the European Beating Plan, is a wonderful opportunity to realign our goal. I agree. The plan should also focus on cancer cells because we have to know more about the molecular profiling on cancer cells to develop effective and more precise treatment for the cancer cells. But the focus should not be the cancer cells. The focus should not even be the cancer patient as an incidental biological entity attached to the cancer cells. The focus should be the cancer patients with their expectation, with their needs, with their aspiration, and more importantly, with their rights. And I would like really to conclude by quoting a great doctor in the 19th century, William Osler. He was just saying that the good physician treats the disease, the great physician treats the patient who has the disease. So don't waste our time treating only cancer cells, but focus our goal on cancer patients. Thank you very much for your attention.
Alessandro, that was a very, very strong statement you made. I think the data is absolutely clear. We'll come back with some questions for you later on. And as we are moving now from clinical data into more policy, it's my pleasure to introduce Antonio Salles, who is the Deputy Health Minister in Portugal, but he also has a degree in medicine, and he has published several publications on active and healthy aging. And he will present to us under the title of Improving Access to Good Nutritional Care in Cancer in Portugal. Please.
Caras e caros palestrantes, ilustres convidados, bom dia a todas e a todos. É com enorme satisfação que marco presença, ainda que desta forma virtual, nesta conferência de âmbito global que traz para o debate o tema cancro e nutrição sob a presidência portuguesa no Conselho da União Europeia e, por isso, permitam-me desde já agradecer o convite que me foi endereçado. Num ano particularmente exigente, são estas iniciativas que mostram a nossa capacidade de adaptação, mas também a nossa resiliência, porque não desistimos perante as adversidades e continuamos a dar respostas a quem mais precisa. Sabemos que a pandemia nos trouxe enormes desafios e não podemos com certeza ignorar que a luta contra a Covid-19 condicionou de forma inequívoca a prestação de cuidados de saúde, onde naturalmente o cancro não foi exceção. Mas também sabemos que é preciso não baixar os braços e, ao mesmo tempo que se combate a pandemia, continuar a dar respostas para recuperar a atividade assistencial prejudicada por este combate. Atualmente estão implementados 3 programas de rastreio oncológico de base populacional em Portugal: cancro da mama, cancro do cólon e reto e cancro do colo do útero. Ao longo dos últimos 3 anos, foi possível esbater de forma muito significativa as assimetrias nas coberturas geográficas, com o aumento progressivo do número de pessoas convidadas e efetivamente rastreadas. No primeiro trimestre do ano de 2020, tínhamos melhores resultados em qualquer um dos rastreios do que em 2019. Relativamente ao rastreio do cancro do cólon e reto, por exemplo, a taxa de adesão em 2020 foi cerca de 43% superior à taxa de 31% em 2019. Mas temos, porém, muito ainda a fazer. Uma coisa é certa, o cancro não deixou de ser uma prioridade, quer para este governo, quer para a presidência portuguesa da União Europeia. E neste âmbito, destaco as ambiciosas metas definidas no Plano Europeu de Luta contra o Cancro, um plano sólido, largamente participado, estruturado, coerente no universo da União Europeia. Este é o sinal claro da vontade coletiva de reduzir o impacto da doença através de medidas que promovam a prevenção primária, secundária, a detecção e o diagnóstico precoce e também o tratamento e cuidados com mais inovação, com mais investigação e com qualidade de vida essencial aos sobreviventes e cuidadores, com políticas inclusivas e igualitárias. Neste contexto da melhoria de qualidade de vida, o Governo tem estado empenhado em colocar a malnutrição na agenda política. Por isso, desde 2016, que Portugal integra oficialmente a campanha internacional ONCA, promovida pela European Nutrition for Health Alliance, que une 19 países numa missão conjunta de implementação do rastreio nutricional e otimização dos cuidados nutricionais, construindo e acelerando a disseminação de boas práticas. Em Portugal, cerca de 1% da população necessita de apoio nutricional com recurso à nutrição clínica, uma realidade que afeta muitos doentes oncológicos e que se reveste de enorme complexidade e exige de todos nós redobrada atenção. A malnutrição associada à doença oncológica não só tem impacto na saúde e qualidade de vida dos doentes, como também representa custos elevados para o Serviço Nacional de Saúde. Urge, por isso, garantir uma otimização do estado nutricional dos doentes oncológicos, nomeadamente pela melhoria no acesso a cuidados nutricionais a esses doentes. E isto significa instituir rastreios nutricionais que permitam um diagnóstico precoce e o tratamento no tempo adequado. Aumentar a literacia dos doentes na área da nutrição, com profissionais de saúde mais capacitados na prevenção e gestão da malnutrição. Desenvolver linhas de apoio e medidas legislativas que permitam que todos os doentes em ambulatório ou domicílio tenham acesso à nutrição clínica de forma equitativa, independentemente da sua condição socioeconómica. Temos enormes desafios pela frente, em termos de defesa de saúde dos nossos concidadãos. É nossa convicção que com iniciativas como estas, com o envolvimento de todos, estamos a fazer um caminho para que os doentes tenham acesso a cuidados nutricionais adequados, equitativos e de alta qualidade. Este é um desafio para o qual estamos todos convocados. Contamos convosco e, por isso, da nossa parte, da parte do governo português, podem naturalmente continuar a contar connosco. Muito obrigado a todas e a todos.
Following this very strong first political statement coming from the Portuguese governance in their role as presidency of the European Union, it's now my pleasure to introduce Laurence Dougon to go more into the implementation work. Laurence is the coordinator of the Federal Nutrition and Health Plan of Belgium, and she is also representing Belgium for nutrition policy at the EU level. Laurence did a great job in the launch of the Belgium ANCA team, and as we've heard from the Portuguese ANCA team, Laurence will now give us some insight on the work, how ANCA can improve the implementation and management of malnutrition in Belgium. Very warm welcome, Laurence.
Thank you very much, Regina. Thank you, all of you, and thank you, ENHA, and the Portuguese presidency to inviting me to talk with you today. So cancer is unfortunately a big health issue for Belgium. We are suffering from the highest rate of breast cancer in the world. 1 in 8 women will suffer of a breast cancer in Belgium. Until now, we don't know why. So of course, it's a major concern for us, and we welcome very favorably the Europe's Beating Cancer Plan. So here some sad numbers, especially when you know that 40% of cancer cases are preventable. So you see that in Belgium, we are facing a lot of cancer cases, especially in adults. Men are more affected than women. And we can assume that 1 in 3 men and 1 in 4 women will be diagnosed with cancer before their 75th birthday. So it's not a good at all situation. So we need definitely improve our strategy to beat cancer, and the Europe's Beating Cancer Plan is a key issue for us, and we are of course involved in the coming subgroup of the steering group promotion and prevention from the DG Santé. So I will introduce some question that we have that we had in our ENHA platform at Belgian level with our stakeholder. As you may know, Belgium is involved since 2015 in the ENHA, so Optimal Nutrition Care for All platform. So we managed our platform in a very positive way with many stakeholders coming from the caregivers, from home care and care homes, coming also from nurse and caterers. So in a very, very large and broad discussion, we have discussed on many aspects, and I will introduce you, if I may. Next slide. First of all, it will encourage the national healthcare to implement a common strategy throughout European countries. So it is very important that we have this EU approach to put the nutritional status at the top of the concern, because undernutrition, as Alessandro and Roberto have said, it's very important to address this problem. And of course, obesity is also a main concern, since it is a risk factor to develop the cancer. Education is also very important in our nutritional strategy, and it is not enough taking into account by all the caregivers. So we need to address a better awareness of the problematic in the caregivers and in the mass media, because as you may know, undernutrition, it's not very popular, especially because it concerns not a population that we want to see in our society. This is also a fact. So since we are very keen to work on it since 2006 in Belgium, we know that we have problem to get enough awareness of media and also of care professional. So it's important to focus on education and also a better definition of and protection of the term of nutritionist, because in Belgium, everybody can be a nutritionist, and this is a problem. We need to fix the term at European level and to protect better this profession. So next slide, please. What would a European approach keep nutritional care on the Belgian policy agenda? Of course, it will be very important, but it depends of the Belgian representative at the EP and their role to better influence the Belgian politics. We are facing 2 main problems. For instance, in Belgium, we have no reimbursement for oral nutrition solution, which is a big problem and big issue particularly for cancer patients, and also not enough reimbursement for a dietetic follow-up. We have seen in literature that only 30% of patients have access to a dietetic follow-up because it wasn't not recommended at all, or because they can't afford it. Affordability of care, it's a key issue too, especially for Belgium. We will put this on the European table. Affordability of care and care for all is very important. Next slide, please. So would a European approach keep nutritional care on the Belgian policy agenda? Yes, probably it will be the case, and especially if Europe will develop a regulation to tackle all risk factors under which nutritional care. Exchange of best practices with other member states active in nutrition care is key also. And of course, as I've said before, nutrition and undernutrition was on the Belgian agenda since long time ago with our federal nutrition plan. So it's not new for us, but we need definitely to be supported by European Union. And finally, I will speak about the Belgian, the benefits of EU to optimize nutrition cancer care. We need to better address study because we don't have enough study on nutrition care, and nutrition care should be very at the center to fighting cancer, to improve the quality of life. Many cancer survivors will keep for a long time a poor nutritional status and chronic fatigue. So as Alessandro Laviano said, we need not only to consider the therapeutic efficacy, but also the cost effective of those interventions. So this is very important. So I've mentioned a need for study, and I hope that the 4 billion euro budget for this European beating plan, cancer plan will serve this new design of study. And finally, I present you the ENHA bread, which was designed by chief school and a gastroenterology center here in Belgium, with full of taste for the cancer patient, with ginger, with lemon, to make them some a better feeling of the taste of this food. We have the same initiative in Napoli, Alessandro, with pizza, and in Rotterdam with Marocchese bread and tagine. So to help them, because at the end, this is the most important thing, that they eat, they eat optimal nutrition and full of quality and nutritional aspect, nutritional support. That is very important. And it is a success story. If you need more information on that, I will share with you. So thank you for your attention.
Thank you, Laurent. Laurent, it was a very nice presentation and so interesting to see how these different levels of policies need to work together to make things move, and then also looking at the practical aspects of nutrition. The last one was very nice. Thank you. We will move on now to listen to Sara Cerdas. She is a Portuguese medical doctor, but she's also the vice chair of the European Parliament's Special Committee on Beating Cancer, and she's the co-chair of the European Parliament's Working Group on Health. So a very central position. And she will tell us how can the EU policy protect nutritional status of both citizens and patients. She will be with us on video.
Hello everyone, and I would like to start by thanking the European Nutrition for Health Alliance for the invitation to speak at this conference. It is an utmost pleasure and an honor to share some of my views into how can the EU policy protect the nutritional status of both citizens and patients. First and foremost, speaking a bit about the importance of optimal nutritional care, as this is quite crucial and sometimes undervalued for patients and, for instance, for cancer survivors. There is a bridge between prevention and care. When we discuss health policies, we tend to discuss disease and not health. Health policies are not only here to treat diseases or risk factors, but it's more than that, and we need to see, in order to have a more holistic approach to health, we need to see the individual in a holistic way, taking into consideration the social determinants of health, meaning where we live, work, study, or where we have our leisure time. Hence, prevention is key into reducing the incidence of diseases. And for instance, for cancer patients that are diagnosed, the major focus of health professionals and family is to provide a treatment to cure or reduce the consequences on health or improve the quality of life. And here I would like to state that nutrition has a key role in the treatment and care and should not be forgotten. As we address cancer, we should also address nutritional status. Because a simple evaluation of the nutritional status of a patient could provide the health teams with better tools into how address and improve the health outcomes of these oncological patients. And if we address the nutrition status, we address cancer diseases and we will have quite an exponential benefit to health. I am one of the vice chairs of BECA. BECA is the European Parliament's special committee on beating cancer. And how will the European Beating Cancer Plan have recommendations and will focus on nutritional care? We have that European Cancer Plan, as it was presented by the Commission. It's a robust and holistic plan with 4 pillars. So it was presented on 3rd of February. So right now we are at Parliament trying to improve it. These 4 pillars that it addresses is prevention, early diagnosis and screening, treatment and proper care, and quality of life for patients, survivors and caregivers. And in this committee at the European Parliament, we conducted a number of several hearings with experts and different stakeholders in the oncology field to try to build the best evidence-based plan and its respective actions. This will allow for these discussions to be reflected in the report, and this will improve the plan. And BECA should have a hearing concerning the nutrition, and I myself, being a medical doctor and a nutrition champion, I believe this report needs to reflect the importance of nutritional care in cancer. I already speak a bit more about this before, but I would like just to underline that prevention is quite important, and we are aware of the importance of and the impact of nutrition in our health. We are aware, but we need also more evidence. And we need to go further and improve nutritional care, especially in diseases that can be quite debilitating as cancer. So our proposal is that cancer centers should integrate nutritional care units, and multidisciplinary teams should include a specialist dietitian or nutritionist, or a suitable qualified health professional specialized in clinical nutrition. This is key in order to make care, better care for oncology patients. And lastly, to answer to the question of how to make the EU policy, how will the EU policy address differences in healthcare systems, the 27 healthcare systems? After all, provision of healthcare is a competence of each member state, but protection of public health is a shared competence with the EU. I would say the answer here is right there, is evidence-based policies. We need evidence-based policies. If we are able to demonstrate the efficacy of EU policies and the importance of investing in order to have better outcomes, it will be very difficult for member states not to work together through their health systems to implement such actions that will tackle down to patients. We also need to promote sharing of good practices across the EU, and this is another way to stimulate member states to implement and act on improving the health of citizens. We also need to work on increasing awareness and improving health literacy, meaning capacitating citizens to take healthier decisions for their lives. And as we are discussing today, we need to increase awareness also with this discussion among different stakeholders, including patients, as they are very much at the center part of the EU policy, and we need to tackle the real needs of patients. So once again, thank you very much for the European Nutrition for Health Alliance for invitation for this conference, and I wish you a great event.
After this important message coming from Sara Cerdas, we are now stepping in more into the clinical part of today's event. And it's now my great pleasure to announce Antonio Parera. He's representing the First National Comprehensive Center in this meeting, as he's acting as a clinical director of the Champalimau Clinical Cancer Center in Lisbon. He is also a professor of medicine of the New Medical School in Lisbon, and he will give us an insight on future opportunities and how Europe's Beating Cancer Plan can impact the daily clinical practice. Welcome, Antonio. The floor is yours.
Well, thank you very much for the invitation and for the opportunity to participate in this very interesting and important meeting that tackles the problem of nutrition and the cancer. In fact, my main work is as an oncologist, working in a dedicated cancer center in Lisbon. And I will share with you some concerns that regard our work, especially in this area of cancer that has been already stressed in the meeting by some speakers. Is a huge public health problem with an increasing incidence, especially in Europe. And we know now that probably within 10 to 15 years, the cancer incidence in Europe as well as in the United States will probably rise by 25%. So this is clearly becoming the leading cause of death in the EU. And now the cancer plan becomes in a great opportunity, especially because we are facing the pandemic of COVID, and this has had a very negative impact in terms of cancer care, because it slowed down or even suspended many screening programs across the world. This created a setting of difficulty in the access of healthcare services other than COVID, because healthcare providers are focused in the treatment of COVID disease. And even many patients fear to leave home or seek medical attention, therefore delaying the opportunity of being diagnosed with early phases of cancer. The big hospitals across Europe also had to focus on COVID, and therefore place the cancer care in a lower level of priority, which, as we are seeing now, transiently, we observe a relative decrease of new types of cancer. But we know that this is just a false decrease in the incidence of new cases, and we'll see ultimately an increase in the number of cases. But unfortunately, we are going to start seeing patients in a much more advanced phase. So what I was mentioning is that the difficulties in reaching cancer care induced a transient decrease in the number of new patients that we see, but we are facing now more new cases in breast, in lung cancer, in colorectal, and in other types of cancer. And this will lead, for sure, in the next few years to an increased mortality for many cancer. The World Health Organization has already studied and estimated that, for instance, for colorectal cancer, the increase will be about 15%, and in breast cancer also from 9 to 10%. And this is data that has been recently published in Lancet Oncology. So there is definitely an increased social and economic impact of cancer in the next decades. Next slide is, I would like just to profit this opportunity to stress the importance of the European Cancer Plan in creating a lot of opportunities that should be and will be certainly opportunities to launch concerted actions in many areas in the treatment of cancer. And this is one of our concerns in our center, is to strengthen the interaction between basic research and translational research, going to clinical studies that should be more oriented to the patient himself, patient-centered and even personalized approach, going a little bit against what is the conventional clinical type of trials, but more focused in patient-centered studies that will tackle what are the main areas in terms of cancer treatment. Let's say the management of risk, and that is mainly prevention, the area of early diagnosis and the development of new tools to have new biomarkers and new ways of doing an early diagnosis, to study the biology of cancer and the underlying mechanisms of cancer progression and the metastatic process, and also to develop new treatment modalities with new pharma, with new medical devices, and further integration of support programs like the nutritional status, as has been mentioned. Just to give you an example, in our center, we have now ongoing 6 studies that tackle problems related to the importance of nutrition in the cancer care, tackling with obesity and other areas of nutrition. And the next slide is just to point out and stress the importance of the lifestyle in what has already been strengthened in this meeting. And this is mainly in what concerns the reduction that we need to achieve in terms of alcohol consumption all across Europe, and to reduce smoking and the exposure to toxic agents, where, for instance, air pollution. This is probably not a very important topic in Europe, but in Asia is a major concern. For instance, lung cancer, that in Europe accounts in non-smokers for about 10 to 15% of cases, in East Asia represents almost 50% of lung cancer patients are non-smokers, which is probably a consequence of air pollution. The other area that is important to observe is vaccination, because this is a group of interventions that can avoid what are avoidable cancers, let's say. The other important point, as has been stressed also, is the control of weight through a healthy nutritional planning. And this, in what concerns Portugal and European countries, must tackle with obesity, that is a problem in our population, diabetes and cardiovascular disease. And the final point is the importance of exercise and a good physical condition in order to tackle with the progression of the treatments in patients that are being treated, but still keep the possibility of having a good quality of life. Thank you very much for your attention.
Pereira, for a very interesting presentation from a developer's scientific point of view, and also from a caregiver's point of view, organizing cancer care. So now it's my pleasure to introduce to you Rocco Barazzoni. He is an associate professor of internal medicine at Trieste University in Italy. But more importantly, he's an old friend of mine, and also the president of ESPEN, which is the leading scientific society in the world for clinical nutrition and metabolism, and a key society, of course, within our organization. Rocco is going to present to us nutrition education, essential component for a high quality workforce. So the scene is yours. Welcome.
Thank you. Thank you very much, Ole, for this kind introduction. Dear colleagues, distinguished guests, ladies and gentlemen, it's really a pleasure and an honor to participate in this meeting and to represent the European Society for Clinical Nutrition and Metabolism as well on such a key hot topic as implementation of optimal nutritional cancer care in Europe. And I thank ENHA and the Portuguese presidency, and also APNEP and Professor Marinho from APNEP for the kind invitation. So Professor Laviano has very well indicated the huge negative impact of cancer on nutrition. Cancer impairs nutritional status, and this creates an unacceptable burden in terms of morbidity and complications, but also barriers to optimal care, maintenance of quality of life, and ultimately survival. We know the numbers are compelling, and so it's also compelling the need to organize better comprehensive disease prevention, diagnosis, and treatment strategies. Now the Beating Cancer Plan, by mentioning the role of nutritional support in optimal cancer patient care, is providing a new opportunity to start to reverse this problem and to more and more take advantage of the positive impact of nutrition and nutritional care on cancer treatment and prognosis. I think this is a reason for optimism, and in fact even I think excitement, and we are aware of the potential improvement this can bring to patient lives. As also indicated by other speakers, indeed is always the case. The key word is implementation. We as clinical nutritionists believe that many effective tools are already available with effective strategies to reach our goals, but we are also aware that even best strategies face challenges to become routine clinical practice and make ultimately a real difference. And I think the strategy also needs to face the complexity of the problem in front of us. Cancer patients have a true nutritional journey in front of them. I don't want to spend too much time here. It's already been mentioned. There are different needs and approaches, from diagnosis to different treatments, or different goals until positive or sometimes unfortunately negative outcomes need to be considered and also specifically addressed. So the basic step of an overarching approach should be identification of patient nutritional needs. And once this is established, implementation of best possible nutritional support. So identification of nutritional needs should be a reliable and at the same time, I think a simple step, using simple tools which should start at the diagnosis and continue to monitor condition through the journey. Screening of malnutrition risk and malnutrition diagnosis are crucial to stratify clinical risk level and decide intensity of treatment and monitoring, which also is key to optimize available resources. So we should be aware that these screening and diagnosis tools exist and can be used after relatively simple training. This is, for example, a very simple tool or malnutrition diagnosis for a consensus initiative of all major global nutritional societies using 5 basic parameters, where GLIM stands for Global Leadership Initiative on Malnutrition, and utilization in telemedicine is also potentially possible, which is unfortunately quite a hot topic during the current pandemic. So after identification and stratification of patient needs, nutritional support needs the highest possible quality level to optimize decisions based on available options. This is, I believe, a key step. A full patient nutritional assessment should be performed by trained and skilled professionals in the context of a multidisciplinary nutritional and non-nutritional also team. So our goal as ESPEN is to implement best nutritional treatment by promoting best science, education, and clinical practices in the field of clinical nutrition and metabolism, along with many partners. And we aim at producing knowledge and make sure it becomes available to make everyday care quality care in every setting, including contributing to create quality teams for cancer patient nutritional support. The journey of clinical knowledge always starts by making a complete survey available of available evidence with evidence-based recommendations based on rigorous methodology to produce guidelines that justify decision-making to optimize treatment. As we want to make it also realistically possible to reach busy colleagues and professionals and make it possible to, for them to use this knowledge, we have started to routinely prepare what we call the practical guideline versions that are based on simplified graphical algorithms, and they are not only published but also available for app consultation. The ESPEN Cancer Practical Guideline and app for cancer are actually just very recently available, and we hope that this good timing may provide additional momentum. Implementation barriers also include language, and we collaborate with many national societies at country level, also outside of Europe, to encourage translation of practical guidelines, which is now starting also for cancer. And last, but definitely not least, we have collaboration agreements with patient organizations to prepare lay versions that may be also used by professionals, but should serve to further enhance awareness in patient and public, and ultimately empower them to be informed about the potential of nutritional care. Besides preparation of specialized guidelines, we believe education is the best possible investment to prepare future colleagues, so that workforce for quality care will be more and more readily available in the future. I just wish to mention that cancer modules are available, for instance, in the online portal of the ESPEN Lifelong Learning, or LLL, educational program. More than 20,000 people have already used some of the available tools, not only for cancer, of course, with choice of online individual sessions and live events. And very early last summer, due to the pandemic, these were transformed into webinars, which are now regularly performed around the world. And since a few years, we have decided to promote the teaching of nutrition and clinical nutrition in universities. It is unfortunately not part of regular curricula, and therefore it's extremely variable across countries and states. ESPEN has established a nutritional education in medical schools, or NEMS initiative, to create a network of physicians and specialists with university leaderships around Europe. And just very recently, we have started with pilot projects to implement and compare various potential teaching and content models. And I'm happy to say that Portugal, with Professor Marinho and many colleagues, is very active and successful in this field and is part of the initiative. Just recently, before the start of the pandemic, when we could still meet in person, a very international group of nutritional societies and university deans signed the NEMS manifesto to promote nutritional education. And since we believe that success is difficult actually without involving, let's say, end users or final stakeholders, we have started networking also with students' organizations. I must say it's been really refreshing to find high enthusiasm and interest in nutrition on the student side, starting from the pre-graduate material that is connected with the ESPEN LLL program. I think this provides really additional motivation and strong reason for optimism, but of course, hard work will be needed to reach our goals. I have used the word networking, and I think this is another really key word I wish to introduce as I move towards the end of my presentation. We believe that networking is necessary with our colleagues from all professions in nutrition healthcare, in other medical specialties, as well as, in this case, oncology. And as I mentioned, with patients and of course other stakeholders, including policy and decision makers when this is appropriate and possible. This slide shows the program, for instance, of the recent webinar we organized to launch the practical cancer guideline, which attracted more than 3,000 registrations and included representatives from many different societies, as you can see here on the right of this slide. We are part, of course, of the European Nutrition Health Alliance. This is a very important and fundamental partnership for ESPEN, and with excellent examples of the multidisciplinary and multi-stakeholder approach that we have mentioned several times, with many successes and progresses already over several years. And based on this foundation and the new momentum coming from the Beating Cancer Plan, we want as ESPEN to further enhance networking, and recently have created in our society what we have called a Cancer Task Force, coordinated by Alessandro Laviano, with representatives from various ESPEN, let's say, professional groups and experts to be prepared to enhance and optimize the level of cooperation with various partners and initiatives. So I think really this is a good time, a very good time to be ambitious. And we hope that the increasing awareness on the essential role of nutritional support to optimize cancer patient outcomes will really turn this opportunity into a reality, to see ultimately nutrition and malnutrition screening and treatment as key components of the Beating Cancer Plan in practice in the near future. Now, I hope I have a few minutes left to make an additional point, as we all know that the COVID-19 pandemic is affecting our personal and professional lives and shifting all kinds of priorities, and unfortunately delaying many urgent initiatives and matters that have been mentioned by several speakers also before. But in fact, in ESPEN, we have made this our motto last year for our virtual Congress, and it's a continuing motto. I think nutrition matters now more than ever. We believe this is still very true. Nutrition matters because we need to face the new COVID challenge. Of course, this also involves many nutritional issues, but at the same time, we have the duty to continue to take care of tens of millions of patients with malnutrition, with obesity, with micronutrient deficiencies, and of course, our cancer patients. None of them really can afford to be neglected, since malnutrition kills. It does not stop doing that during the pandemic. And in fact, it becomes more dangerous. So as I started by summarizing the negative impact of malnutrition in cancer, I wish to also very briefly summarize that malnutrition is also common, and it worsens outcomes in frail COVID-19 patients. And it's becoming really a key player also in the emerging long-term consequences of COVID-19. We know that weakness, fatigue, slow recovery are very common, and we call them now long COVID. And this is our recommendation algorithm, in particular for patients recovering from COVID-19, to monitor nutritional status and malnutrition risk with tailored nutritional intervention in the presence of malnutrition and deficiencies. But the point I wish to make is I hope that you also see the similarities with the cancer paradigm. And again, this absolutely cannot be a reason to neglect the cancer emergency. In fact, to the contrary, since malnutrition cancer patients are unfortunately targets for severe infections with high mortality. And so I think the importance of nutrition for this perspective should be emphasized as a common ground and a target to prevent complication and save lives, starting from the most frail and exposed patient and conditions in every setting. So on this note, to conclude my presentation, I really wish to mention our initiative together with many global partners. It's a very new initiative to promote recognition of nutritional care as a human right. This, I think, really connects with what Robert Greene was mentioning at the very beginning. And we believe that nutritional care and support, just like nutrition itself, should not be denied in the time that they are needed most, that is in the presence of disease. My take-home messages are therefore as follows. Nutrition and nutritional support are essential components of cancer patient care. Tools for simple and reliable identification of patient nutritional needs are available and must be implemented to lead to quality treatment. Strategic investments are needed in terms of quality education aimed at building nutritional support patterns and teams in each country and institution, ideally, and awareness on the role of nutritional support needs to continue to be enhanced also outside of the clinical nutrition community, including networking and dissemination initiatives for best knowledge, guidance, and clinical practice. Nutrition matters more than ever, also in the COVID-19 pandemic years. So thank you very much, and it has been a real pleasure and honor to participate in this event.
Thank you, Rocco, for this very nice and comprehensive talk outlining the importance of the work of ESPEN to create the evidence and the bulk of capacity you have present for implementation of nutrition in various settings in terms of health. So if you're serious about health, be serious about nutrition. This is what Anna says. And you've also touched upon the importance of the multidisciplinary team. And in this context, it's my pleasure to introduce the last speaker of today, Nicole Eriksson. Nicole is a clinical specialist dietitian with a certificate in the US and also in Germany. Currently, she's working in Germany at the Maximilian University Clinic in Munich. She's a member of a comprehensive cancer team. And she is also the lead of oncology specialist network of EFAD. EFAD is the European Federation of the Associations of Dietitians. She's the speaker of the German Cancer Society Nutrition Working Group. And Nicole today will speak about the importance of the multidisciplinary team, integrating nutrition into cancer care continuum. Nicole, the floor is yours.
Good morning. I am honored and humbled to be here today. And I am honored and humbled to be part of the message that we are giving today. Thank you for the introduction. I don't think I need to say anything more about myself. The main association I represent here is, like she said, the European Society of Dietitians. We have many members throughout Europe of national dietetic associations, and we are advocating for patient care. As many of the previous speakers have said today, malnutrition is a problem, but many have not mentioned how long it has been a problem. In fact, before I was even born, Butterworth and colleagues first published the fact that malnutrition is a problem, and they referred to this problem as a skeleton in the hospital closet. Unfortunately, today, still 30 to 85% of cancer patients are estimated to be malnourished. This is largely dependent on the tumor stage, cancer type, location, and type of therapy. That's why the range is so high here. But a recent large study conducted in Europe and Canada showed that 73% of patients experience unintended weight loss along the cancer care continuum. And that in fact, the combination of the body mass index and the percentage of weight loss was associated with overall survival independent from the type of tumor, location, and stage. This is very important for us all to know. Unfortunately, this is still a problem today because currently a gap still exists throughout Europe between patients' needs and the integration of nutrition care at every point along the care continuum. Therefore, I suggest that now, after more than 40 years, it is time to change our strategies. We need to clean the skeletons out of the hospital closet. We need to prioritize the right to high quality nutrition care throughout the cancer care continuum. Our vision is that as a patient moves along the care pathway, the patient is also provided with equal and consistent access to high quality nutrition and dietetic care at every stage along the continuum. We are currently very, very far from this vision. Optimal nutrition care can only be achieved through complementary contributions of all members of the multidisciplinary team. In fact, a scoping review of over 31 studies, including in 6 countries, revealed the significance of the interrelationships between different multidisciplinary care models and improved nutrition care. Studies also show that the implementation of multidisciplinary nutrition care teams, including a specialized dietitian, nurse, and physician, has been associated with higher rates of meeting calorie and protein goals, better outcomes, less adverse events, and reduced mortality rates. Unfortunately, today, multidisciplinary teams often do not include specialized dietitians, nurses specialized in cancer care, and sometimes the physicians are just oncologists and do not have time to think about nutrition care. Therefore, the evidence underscores the fact that nutrition is more than just food. It is actually a component of care that can and should be improved. So what steps do we need to get there? Policymakers need to first better understand how the key healthcare system building blocks need to interlock and effectively integrate to scale up nutrition services throughout the system. Healthcare systems should be required by policy to improve effective and efficient integration of nutrition care throughout the cancer care continuum. This means that all national authorities should establish national nutrition screening groups that are linked to comprehensive care centers and require not only mandatory screening, but also mandatory follow-up care once the screening has occurred. Financial barriers need to be minimized and eliminated because these present one of the biggest hurdles that we have today to producing this care. I can say that from experience in our comprehensive cancer center. Accurate and consistent nutrition care messaging is essential to patient confidence and supporting them in decision-making. This cannot be delivered without the multidisciplinary team. All patients should have timely access to dietetic care, information, and resources produced by high-quality specialized dietitians. Minimal standards for cancer care should thus include, in the multidisciplinary team, dietitians, nurses, physicians, and other care specialists. It's also worth the investment if we go there. In fact, studies have shown that every €1 spent on dietary counseling can bring society a net benefit of 14 euros for every euro of investment. This investment pays off even better if we consider the high vulnerable patient groups such as gastrointestinal patients, head and neck patients, and elderly patients. Then the investment will pay off even more. For today, as a dietitian, one of our strengths is the ability to translate evidence into practice and provide the tools to implement and adjust recommendations to individual needs. Therefore, I would like to leave you with a recipe for success. We all need to start with a base that is made up of a strong structural framework. We should combine this with one portion of awareness, one portion of education. We need to stir in multidisciplinary cooperation, add a variety of communication strategies, and spice it with patient participation, leadership, and change management strategies. We should cook this all slowly, but we also need to serve it on a very well-financed plate. As needed, we should adjust the spices to individual situations and needs and adhere to situational problems and see how every situation can be changed to make this recipe a success and to taste good in every country. Remember, nutrition is more than just food. It is an essential part of medical care, and it is a component of care that can and should be improved. Thank you for your attention today.
Thank you very much, Nicole, for that very nice presentation and summing it up in a very practical and daily basis and easy to digest version what we should do to implement the work. Now, we are now coming, this was the last speaker, we are now coming to the Q&A part of this today's meeting. And first, I would like to thank all our speakers who have made a really powerful case for integrating nutritional care into national nutritional implementation plans. Although high awareness of nutrition in the prevention of cancer is present, please remember our focus today has been on the importance of protecting the nutritional status of patients with invasive cancer, so that they can get the very best outcomes in terms of survival, but also quality of life. So with that in mind, Let me start by directing a couple of questions on behalf of our delegates. I must say that there have come in a couple of questions, and I will really try to cover them all and pose them to our delegates and speakers. And I would like to start with Professor Laviano. Yes, he's still online, Professor Laviano. Thank you for your nice talk outlining the evidence on the impact of nutritional care in cancer patients. We have learned from you that it's a huge problem. Malnutrition is a problem in cancer patients, and malnutrition may impair the patient's response to treatment and quality of life. But if I got you right, you are saying that there is now really a confound evidence and proof that the early use of nutrition increases the chances of survival and quality of life. And I would like to re-question once more. Could you once more explain in a few words, in detailed words, more about this case of the impact of nutrition in the indicator and outcome of cancer patients?
Yeah, thank you very much, Regina, for that, because I believe that we all agree that nutrition per se may not actually treat cancer cells, but actually it has been now very nicely demonstrated in large prospective randomized clinical trials in the top journals, which show that when you combine early supportive care, or as oncologists say, palliative care, to disease-modifying therapy, you will have a significant improvement, not only in quality of life, which of course is the goal of nutritional support, but also on survival. And these with an additional and fractional increase of costs, because this kind of intervention is really, really minimal when compared to disease-modifying therapy. At this time, there is no one who can actually really deny these evidence. So I think that it's now time to really implement this approach.
So you are saying that on the basis of evidence, this automatically must be entitled cancer patients have access to good nutritional care. Do you also think this needs to be spelled into implementation plans on a national level?
Well, I think so. I think so because first of all, the evidence out there. So what we are proposing, what I'm proposing, what ENHA proposing, what ESPEN is proposing is something which is evidence-based. It's not based on opinions. It's based on evidence. But more importantly, of course, how to implement these in the national in the national health systems, of course, may be different. But what is important is really that there is a huge statement by the European Union, European Commission, saying this is the basic level. All cancer patients should receive nutritional support, because everywhere, from the north to the south, from the west to the east of Europe, can receive this, because this is affordable for every nation. Then we can discuss about the most sophisticated drugs, but this is available for everyone. And this is associated with significant improvement of quality of life, which, by the way, appears not to be very much considered by EMA, by FDA when they approve cancer drugs. So this will have an impact on quality of life, and also, if combined early with the disease-modifying therapy, also on survival.
Alessandro, may I just ask you an additional question so we get this in perspectives a little bit, because the medical care of cancer patients involves new drugs, new different treatments. How does nutritional, the data that you showed on the difference in survival, how does that compare with a new drug, for example? Can you give us some sort of ballpark idea?
Of course, this is interesting because it seems that you have the same effects of a drug, actually. But what is really amazing is the fact that there is a nice paper in Cancer Survivors showing that if you implement the healthy and optimal diet, which Robert actually was mentioning, Laurence were mentioning in their talk, you have a significant improvement in the reduction of the risk of relapse of the tumors. Interestingly, the NNT, which is the number needed to treat, is even lower than the most sold drugs in the world. like proton pump inhibitors. They have a higher number needed to treat, which means that you can get much more effect with really a fraction of the cost associated with the new drug. I'm not saying that you can cure cancer with the zucchini and banana and oranges. I'm not saying that. I want to be very clear on that. I'm just saying that it can help drugs to be more effective.
This is a very strong and important message, and that should bring us really towards implementation. And I think many of the speakers have touched upon models of implementation, and that brings me to my first question on how to implement and what we need in terms of structure. And I would like to ask Nicole, if possible. I mean, Nicole, you have showed us very nicely that the role of the MDT is essential to deliver the integrated care pathway for nutritional care for cancer patients. And you're working in a comprehensive cancer center in Germany, outlining your practical expertise. And what do you think? Could you share with us how we could probably make use of your best practice model in Munich, and other centers could probably align and scale up what you have already been doing in Germany?
Actually, I'd like to reframe that. I'm very lucky in Germany. Because in Germany, we are, like many other countries in Europe, still lacking policy and strategy. There are no national mandates that provide minimum standards that need to follow for nutrition teams within the multidisciplinary team. Nutrition is not named, psycho-oncologists are named, but it is not required even for the certification of national cancer centers at the moment. Screening has been implemented, but not even with the consequence of nutrition care being provided upon a positive screening. I am lucky because very few hospitals in Germany even have a nutrition care team or a dietitian on staff, and this is the reality throughout Europe. In fact, I built up my nutrition team from scratch in only 2017, and that was because the president of our university decided to invest financial resources from our own university's resources to pay for this team. The rest I have to struggle to support through grants, through donations, any way I can, and that takes up, unfortunately, too large of a part of my time, which I should be using providing patient care. Therefore, I would like to plead that funding and resources and also the structures and the policies are put in place so that we do not have this struggle anymore, and we can just provide care without having these walls that we come up against in trying to do so in our everyday life. Then I think these multidisciplinary teams that I showed here in my presentation would be able to function in a much more efficient and positive way, and we would be able to integrate them throughout not just comprehensive cancer centers, but all hospitals throughout Europe.
You were showing that it's doable, and I think this is very important. And I think also Rocco stretched the importance of the multi-professional team. So building the frameworks for this, the structural frameworks on a national level, is key to support the people doing the work on the ground. You were one of the speakers also touching upon the economic part of the story as an indicator by lowering hospitalization rates, etc., when integrating an MDT in the team. And several of the participants have raised the issue of reimbursement in the chat. So working in a CCC, and you're doing this work already, and you have stretched some or shared with us some insight on the economics. Could you probably go into a bit more into detail on the reimbursement you are facing on a local level, and also your insight on the international level?
Like I said, in Germany, and also throughout Europe, reimbursement is not a priority. It is not part of our system. And the only reason we provide the care in our cancer center is because our hospital put aside the money for it, and they are not reimbursed for it at the time. This means that other hospitals can't even afford this type of care. We are lucky in that sense. So reimbursement is a very big factor that we need to enable more people to start and have this sort of team. What I have been able to do is use my resources, use a lot of baby steps, use a lot of free resources. And that's first steps is a way to show that it can work. And maybe we have a good example, but we are a hospital of over 10,000 beds. We have 6 dietitians in our team that serve these beds, and that is not enough we can't keep up with all the questions and answers and needs within our hospital, and we need to prioritize actually just because of that. So the finance is the biggest hurdle, I would say, that I face in our day-to-day life, even though I am in a very good position compared to others.
So thank you. If I listen to you, the capacity building is key, and capacity building among health workforce. I would like to ask another question to Rocco, if possible, with a very short answer, given the short notice time we still have in this meeting. Rocco, the cancer plan has made clear that training in nutrition support is required for the cancer workforce. But what does that mean? I mean, can you give us 3 explicit things that we would need to do to address this capacity building and to address the inequality in nutrition training? And who should receive the training to close the gaps that were shown by Nicole?
Well, yes, thank you, Regina. I think this is, of course, one of the key issues. Quality training is needed. This is not something to be taken lightly. This is high quality teams are needed to optimize the conditions. So to make it short, an answer to maybe your question, I think one key issue is we are lacking, let's say, uniform nutrition education in medical schools. Of course, there are dietitians, there are many very competent and trained professionals out there that are an integral part of the multi-professional team. But I think that in medical schools, there is really a need to have more comprehensive and regular nutrition education. I think this is something, this is an investment not for maybe today or tomorrow, but in a few years, hopefully we will be able to have a regular approach. And I think we found great enthusiasm and interest actually in students, at least those that we have been able to address. So there is really more and more awareness that this is important. We need to give the tools, make the tools available. We are trying, second one, maybe to make nutrition education available also for those who are already professionals. Educational programs are there. I quoted the ESPEN programs. Alessandro is our director for the LLL education, but there are also other opportunities, of course, and they are available. So it's not too late to catch up if you are already, let's say, trained or graduated. And I think also very important is the collaboration with other stakeholders. I would like to mention always the patient, because the patients may provide an important, let's say, push for the awareness of this need. So I think that if this is all combined together, we will be able, maybe, I'm optimistic that we will be able, with resiliency and consistency, to push forward. So, yeah.
Thank you very much, Rocco. I think you were already leading to my next question. I would have asked to Robert. You were mentioning the patient. I think the patient are in the center of the care process. And this is why I would then lead to my next question to Robert. The cancer plan highlights that the need for awareness and health literacy coming from the patients, who may then ask for their nutrition support in the care process. What about the information needed from the side of the patients? Is there any guidance needed around the nutrition, Robert?
Well, thank you, Regina. To answer your question directly, yes, there is guidance needed. And it is, as from a patient perspective, myself, it is always quite amazing, or the fact that when we are patients, that we talk about the need and the importance of nutrition, when during our normal, let me call it, healthy lives, we don't question if we need to have nutrients in our system. So it's kind of a strange that when we are dealing with an illness, we have to then question if it is important to have optimal nutrition. So we need to realize that the time also, from my opinion, of talking about nutrition and talking about the importance of nutrition has passed. It's time to now implement regulations start working and making sure that our patients are as healthy as possible, so that the outcome of their treatments is as optimal as possible as well. And I just want to mention that there's also one other stakeholder that too often, in my opinion, we forget, and that is also the collaboration with our chefs. When we look at hospitals, that we need also the chefs to be talking with the dietitians, because they can advise the chefs what ingredients they can be using to help the patients, individual patients, even when we're talking about taste alteration. So a long answer to your question, we need guidance, definitely. We needed it yesterday. So I hope that this session will help to push things forward. Thank you.
Thank you, Robert. Thank you very much for your contribution. So given all the different perspectives from the patient and the patient organizations and all the experts around the topic, I would like to ask the final question to Laurence, who comes from the political perspective and has a tremendous experience in implementing the ENHA campaign in Belgium and also has influence on the European level. Could you please share with us once more, Laurence, what do you think from your experience from Belgium? What can other partners who are online learn from your experience, and how could we in the regional perspectives support the implementation of the beating cancer plans and implementing nutritional care as a holistic part of the care plan?
Excuse me, your question was the implementation.
How could we do the implementation? How could we support it coming from a political perspective?
Actually, it's not easy to have a top-down approach for every country around Europe. We have many recommendations, but the problem is to reach the local level. And sometimes the local does better than the national level. As Nicole, I think it's Nicole, said as a dietitian, she has facing a difficulty of budgeting, of many aspects on the ground. And this is a very big issue to have enough budget at local level. Coming from the federal level is the same in Germany and in many states in Europe. But I think the first concern is to have enough awareness of the structure. Each hospital has to taking into account the importance of nutritional care. This is first concern. This is very important. And since in Belgium we have nutritional team for each hospital, it is definitely a priority. So we need to set this as a minimum standard. Then, and it comes from the federal level, this recommendation, it is well applied on the ground. And second, we need to have a European recommendation to help us to better address the importance of this nutritional care for the cancer patient, but not restricted to the cancer patient, for all the patient, because undernutrition and obesity problem are not restricted to cancer patients. So this is a main concern, that we have a better budget, and this is the purpose of European Union. They allow us to have a big amount of money, 4 billion. It's amazing amount. So I hope it will reach federal level, but also regional level, with many studies, many initiatives, many action to help the patient. This is at the end the most important thing, I think.
Thank you very much.
So thank you.
Thank you. Thanks to all the speakers. I would just, at the end of this very, very interesting meeting, like to summarize probably a few key points we were elaborating on. I think we all agree that there is now scientific evidence, and this evidence is inarguable, that high quality cancer care cannot be delivered in the absence of optimized nutritional care. The nutritional care that patient receives has a significant effect on their chances of survival, as well as their quality of life. and must be made explicit within national implementation plans if the aim of the cancer plan in addressing inequalities are to be achieved. If you're serious about health, you should be serious about nutrition. In short, science, best practices, training, and education, and the patient in the center of the care process. Let me say it was a great pleasure for ENHA to host this meeting. And we say a very warm welcome to all of you. We will be following up after this meeting with all issues raised by the delegates and raised by all the participants coming in via the chat. Also on reimbursement, ethical questions, and digitalization. And we will try to leverage all the issues raised today on a more international EU level and inclusion in beating the cancer plan to ensure that inequalities of European citizens are fairly addressed. I want to thank all the delegates, all the participants, and I want to stress that if any of the participants has a question or further comment to this meeting, please do not hesitate to contact us via our office. We will be available to address your questions, and we are looking forward to work together with you in the future on all the topics and issues raised today. Thank you very much for your contribution and for your participation, and have a nice time. Thank you.